President of the Diabetes Health and Wellness Institute and Senior Vice President of Baylor Scott and White Health Weight Management Services. Thank you for being with us today. Talk a little bit about what you all are trying to achieve and why it's so important in the community.
Well, first of all, thank you for allowing me to be here. Our encouragement at the Diabetes Health and Wellness Institute is that we look at the issue of hunger within the context of the concept of population health. So for population health, for our institution, Baylor Scott and White Health, we're looking at our being responsible for the overall health of a given population. That means the definition of population health. And so the model of population health that we are driving at the Diabetes Health and Wellness Institute is first asking the question, what are the determinants of the health or poor health of the community for which we have responsibility? That then drives the research agenda. And Commissioner Rowe talked about that. If we ask the right questions, then we delve into research to determine what are those determinants, and then how can we favorably address those determinants to improve overall health, not just relieving hunger, but improving overall health. Then that research agenda should drive policy. So that means that we should be engaged with our government leaders to say, look, these results that we got from research, they really improve the health of the community. Let's drive policy in order to make this pilot into a widespread initiative that improves the health of the community. And then that policy should drive resource allocation. So a little history behind the Diabetes Health and Wellness Institute. It was formed in 2010 with the idea of reducing the incidence of diabetes in the zip codes that we serve, mostly in South Dallas. And so in doing so, we recognize not just our research, but the research of others involved in this work, that nutrition is a very important part of the management and of the prevention of diabetes. So recognizing that is the case, then that showed us that there are three parts of that issue about nutrition. I'm going to connect it to diabetes, but I would argue you could make the argument that it relates to many chronic diseases. The first is awareness. That is, making individuals in the community aware that nutrition is important, not just for diabetes. As I said, we can make the argument for many chronic diseases, but nutrition is important. The second part that we recognized that was important was education. So the data says, some of which we've generated, but others around the country have generated, that says fresh fruits and vegetables are good for your health. They work in helping in the management of diabetes. Just what your grandmother told you. You eat your fresh fruits and vegetables. That helps in the management of diabetes. It also helps in the prevention of diabetes. But what we recognize is that even when we got these fresh fruits and vegetables to many of our population, they ask, what do I do with this? It's not pre-prepared. I can't just drop it in a microwave. What do I do with it? So the second part of that we learned was education. And by the way, these are things that we learned from engaging with the community. We have learned the hard way that the best way to do these things is to come to our community leaders and say, we have resources that can help you. How can we use these resources for your benefit? And this was one of the lessons that we learned, was the need for education. The last lesson that we learned was access. We needed to provide access to this in terms of not just affordability, but in terms of location. So all of these then led us to do various farm stands around our area. And we've been able to show that putting those farm stands there at affordable prices that the food is available, with the instructions as to how to prepare these foods. In our own data, it is shown that it has led to a decrease in emergency department visits and a decrease in inpatient. So for my own organization, that's that's something that they see a value, and therefore, with showing those research results, it has encouraged us to use not just grant dollars, but operational dollars to invest in this, because if it's reducing inpatient admissions, which are expensive, if it's reducing ED admissions, which are expensive, and it costs less to invest up front, you don't need an MBA to know that that's a good thing to do. So that's an important thing about the engaging with the community, asking the question, and responding accordingly. And what we're waiting for is the results of ultimately why we reform, the reduced incidence of diabetes in the zip codes to come. We are hopeful to be able to present that data in a few years.
Thank you so much, Dr. Wilson. What a great overview of everything that we've learned, not only how to operate the farm stands, but how to stand back and let the community guide the operation as well. And we're going to have a lot more questions about that in just a few minutes. So let's move on now to Rhonda Rutledge. Welcome, Rhonda. She's Executive Director of Sustainable Food Center of Austin, and she has a short presentation to introduce us to the mission of what Sustainable Food Center is working on.
Thank you. I'm going to do it from the podium so that I can actually see the presentation. I've been with this organization, Sustainable Food Center, for about 10 years. The agency's actually been around for 41 years. We were founded in 1975 as Austin Community Gardens, and over time that grew into an organization that works with people not just on how you grow fresh local produce, but also how you share it in the community. And that might also mean selling it in the community, and then also how you prepare it into delicious and nutritious meals for your family. With the mission of cultivating a healthy community by strengthening the local food system and improving access to nutritious, affordable food. Our motto, again, is grow, share, prepare.
If any of you are joining us late, Audrey Rowe is National Administrator of the Food and Nutrition Service at USDA. We just heard her keynote. Would you like to expand on anything, particularly the SNAP Online?
Just a couple of, the SNAP Online, which was just announced yesterday. Time is perfect. We will be providing some pilot projects to allow SNAP participants to purchase online. Some of this grew out of some experiments or some pilots that we did early on, very small, in the city of Baltimore and a couple of other places, where we allowed purchases online. We had to work through several issues because, one, you want to make sure that when somebody's making the purchase online, and they put in their PIN number, that they actually get the delivery of the product that they have purchased. So we've had to work through, and the pilots are going to help us understand what some of the other technology challenges may be for these purchases online. But we're really very excited about it. It was something that the Farm Bill allowed us to do. The other thing that the Farm Bill gave us was the food, what we call the FINI grants, the Food Insecurity Nutrition Incentive Grants. And it allows us to provide grants to about 28 projects throughout the country that will provide incentives, financial incentives, for the purchases of fruits and vegetables for SNAP participants. We've also spent time, resources in strengthening the infrastructure for many of the farmers markets. We now have about 7,000 farmers markets that accept SNAP. I just looked a few weeks ago at how many we're actually redeeming, and we're finding that not all 7,000 markets are redeeming, so now we're trying to understand why the redemptions aren't happening in those markets. And once we have that information, we're going to make sure that advocacy groups and organizations throughout the country are aware of where there are farmers markets where SNAP redemptions are not happening, and work together with the farmers to figure out what we need to do or what they need to do or what the coalitions and community can do to help SNAP participants access those farmers markets. As you were talking about our technology, and Russ talked about it too, Russ and I probably about same age bucket, I won't say what that is. He was talking about OEO, and for a few minutes I started thinking about, there was a time when I came in about the early 80s, we talked about holistic approaches to delivering a service. No wrong door. Individuals being able to go into any door and apply for programs and services and to get support. The technology will allow it to happen. problem is the way our programs are funded, and the various committees that they're under. Some of my programs actually sit under two committees. So I have an appropriations committee and an authorizing committee. The appropriations committee actually makes the funding available. The authorizing committee authorizes us to expend the funds. And so sometimes there are differences and changes that happen at that level in terms of funding. So one of the things that I did get to say that I would encourage you all to look at is how are programs at your state level funded? What are the funding sources? Whether or not there is state legislative or state funding in to support some of these programs. Is there a better way to leverage the funding that is coming in? Can you bring state agencies together? I mean, if you look at our CACFP program, some of them are in the Department of Education, some of them are in the Department of Human Services, and one or two are actually in the Department of Agriculture. So in some state, you may have one program being operated in different agencies for different purposes. Some are for one, at risk, and some are for others. So really understanding and mapping what some of the challenges are. When you start looking at affordable, how do we increase the incentive programs that are not only funded at the federal level, but how do we get companies and corporations more engaged in helping to fund some of these incentive programs? Hunger is a health issue. The health community is starting to understand that. And they're starting to say, yes, we need to step up to the plate. And we need to think about how we can support and what programs we should be engaged in to help address the issue of hunger.
I think you both have follow-ups to make. Dr. Jackson, you want to say something?
Yeah, just Courtney, you have addressed a very difficult issue. Three responses I've had. So first of all, the adults with chronic disease that we deal with, they're already incented because of the chronic disease. Mostly diabetes is what we deal with. Secondly, we've talked about the importance of coalitions. So we have relationships with 27 churches in South Dallas, and the buy-in of the faith community and the support of the faith community as to the importance of nutrition and how that is accomplished has been extremely helpful for us over the years. And then the third thing is that we have a program. I talked about educating individuals as to how to prepare, choose, and how to prepare fresh fruits and vegetables in a way that was described. We also do it for middle school students. And our hypothesis is that the middle school students, once they learn what they do, and they start doing it in the home, that's going to influence the habits, the eating habits of the home. We have a pilot going on to explore that. Again, the importance of research. What we'd like to be able to say is teaching middle school students how to prepare fresh fruits and vegetables will favorably affect the eating habits of their families. Hopefully, in a couple of years, we'll have enough data to be able to say yes or no.
I think the other thing that we have to remember is that everyone doesn't have access to fresh fruits and vegetables. So they may have the corner store, and that's where they buy. It may be a gas station that has a store, that's where they buy. So how do you, when you're purchasing foods in cans, how do you ensure that you get, you can use that food to be more healthy? How can you make it more healthy? The fact that you can, drain it and get rid of some of the sodium, and giving people tips and ideas on how to use what is available. I mean, one of the things that I feel that I see as I move around the country is that there are some folks who don't have kitchen utensils. They don't have saucepans. They may not be in a location that has a stove. They may only have one of those burners, one of the Bunsen burners or something. So how do we provide information to individuals wherever they are, from wherever they are, as to how they can use what they have available to make food healthier as well as tasteful?
One thing I was curious about is the concept of the small substitution. So we know that families probably not going to go from a steady diet of fast food and mostly calorie-rich, nutrition-devoid foods to all fresh produce and lots of whole protein. But if someone says, okay, I'm going to switch from whole milk every day to skim, or I'm going to switch from potato chips with my peanut butter jelly to carrots and hummus, just one substitution, something small, is there a difference to be made there, both in terms of health and changing the palate of that particular person and getting them maybe prepared for larger changes down the road?
Well, I can address it in terms of management of diabetes. Yes. So our patients that we are following, so we have a clinic associated with the Diabetes Health and Wellness Institute also. And so we're able to measure the parameters of their diabetes. And one of the things that our diabetes educators do is to show them one change that they'll do in their diet in the way that you just described. Substituting a fruit for a donut, something like that. And just that one change, and then showing the patient that their parameters, usually blood sugar, gets better with that one change, then encourages additional changes that they can make. So yes, small changes do make a difference.
What about just the level of comfort with a new environment, like a farmer's market or even a market style grocery store when you're used to shopping elsewhere? Is that something, Rhonda, you might be able to speak to this? $double, it sounds hard to resist. If your money's going to go so far, it's hard to resist going somewhere where you can use it. Is it hard to get people used to a different shopping scene?
I think the key is to not expect people to come to you and plant yourselves in areas that are really accessible. The City of Austin Office of Sustainability just did a report that was basically a local report on the state of our current food system and making some recommendations to City Council as they were putting together their budget numbers. And one of the most striking things that came out of that report, when you actually ask community members what is the issue, it's physical access. It's I don't have a safe street to walk down to get to where my food is. I don't have a way to get to a farmer's market on the other side of town. My neighborhood is, not well lit, after dark, and so I'm not able to actually go to purchase groceries when that's the only time that I can. So a lot of the recommendations that were made had to do with actually, tying all of these things together. When you're looking at issues of poverty, affordable housing, transportation, and food is all in the same bucket. It's all part of the same thing.
I ask students that all the time when I visit them, as you learn about new fruits and vegetables, is that changing what you eat at home? Do you have, are your meals more healthier in terms of what your family has available? And by and large, children will say, yeah, sometimes, but my mom doesn't really know how to cook this. Or we can't buy this in our community. And trying to work with schools to identify resources that they can bring into the schools, engage parents. There's a program that I saw very recently called Family Night. And it is a feeding program, and parents are encouraged to come in with their students, and there are cooking stations all around. And they're introduced to foods that the children are going to have that month on a menu. And they're given an opportunity to taste it themselves. And they have easy recipes for them to be able to use. They have places where they can go and buy this food or these products so that they can use them in their schools. They have, in one school in Pasadena, where they have a farmer's market that is 1 block away from the school, so that the farmer's market goes to the school on a regular basis and talks to parents as they're bringing farmer's market leadership, as they're bringing their children in, talking to them about the farmer's market is available. Mighty Bucks is what their program is called, letting parents know that the market is just down the street. You can drop off your child, go over, pick up fruits and vegetables, or when you come in the afternoon with your child. So there are various community-based. You really have to start with what works in your community. What works in Austin may not work in Oak Cliff. What works in Pasadena may not work in DC. What works in Southeast DC doesn't work in Northwest DC. So we really have to do community mapping and understand what works in our communities, and our communities have to be part of the mapping.
Absolutely.
So they themselves have to be able to talk about why they don't purchase, or what the challenges are for them to engage in changing their diets. That's really where I think the change is going to happen. I'm going to tell you, it's not going to happen in Washington, D.C. It's just not going to happen in Washington, D.C. And not in my lifetime. Maybe in some of you younger lifetimes, but not in mine. So the change has to come locally. We really need to put our emphasis and our efforts at the local level and understand how we change block by block by block. If you look at the Holland Children's Project, it started block by block by block, and it made monumental change in the city of New York. Those are the concepts that I think we have to go back to in terms of understanding how to work in our communities and change people's behavior. People's behavior will not change just because we wanted to, or we encourage them to, or we tell them to. It'll come because they themselves choose to.
And that's a perfect way to segue into what I was about to ask you, Dr. Weston. You spoke a bit about this in your introductory remarks about how when you all decided how you were going to do the farm stand program, where it was going to be, it didn't work as well as when you stepped back and said, let's let the community kind of inform our decision making and guide us, and let's learn from the people we're serving. Can you kind of talk about when you figured out that was the way to go?
After making many mistakes. And so the faith community, again, has been instrumental in the success of nearly all of the programs that we've done. You were talking earlier about the access to fresh fruits and vegetables being a new experience for most folks. That certainly is the case. And so one of the things our faith-based community taught us was that they would make, so we have put farm stands in many of our church communities, many of our church partners have farm stands on site at their churches.
Because that's where people go.
That's where they go, and they also turn it into a fellowship opportunity. So the shopping for food now becomes an opportunity for fellowship. So instead of having the fried chicken and heavy gravy mashed potato dinner, you now have a farm stand where we shop for fresh fruits and vegetables, and we have folks on site who can teach them how to prepare.
So I have a couple questions from the audience that have been carefully curated. So I'll pose this and whoever wants to take it may. I have heard that frozen foods retain their nutritional value very well. How about frozen food, fruits and veggies, lasts a long time, easy to prepare, and cheaper? Farmers can take produce immediately to be frozen. Even with double dollars, farmers markets are expensive. A large family can't always afford it. Anyone want to address that?
Well, I think, as I said earlier, canned foods, frozen foods, it's letting, in some ways, the fresh fruits and vegetables movement, if you will, has risen very quickly, and families who don't have access to fresh fruits and vegetables are feeling as though there really isn't anything they can do, because we're not telling them that frozen is fine, can is fine, rinse it off, cook it the same way, you will have less sodium in your diet. We really need to provide alternatives for people, as I keep saying, for where they are, and having access from their own neighborhood and community. There's a community in Pembroke, Illinois, which I've been doing some work in. There is one grocery store in the area, and it's not even a grocery store, it's part of a gas station. And that is the only place within and I forgot the diameters of the area, but it is a fairly significant community that has one store, and in order to get to a grocery store, it's at least a 20-minute drive. So if that's all you have available, folks go to that store. And that was one of the reasons why we also were trying to change with the retailer rules, the corner stores, and have some healthier options that are in the corner stores that people can purchase. But fruits, frozen and canned fruits, we need to allow people, just tell them how to use them and prepare them.
Yeah, it's really important, I think, in any kind of cooking program to not use weird or odd ingredients, actually use what people have access to that they buy at the grocery store that they typically go to. But you can talk about things like shop the perimeter of the grocery store, try to avoid the middle aisles, read labels, when you're actually reading some of these labels, know what that means when it says, when you see that sugar is the second ingredient on there, what does that actually mean? But yeah, it's, a lot of times we talk about fresh is best, frozen is next, and canned is also healthy. You just have, the way that you prepare it, it's all in the way that you prepare it.
I agree with everything that I've heard, but I would also go back to the model for population health, research driving policy. So if you show that put in a farm stand, which we've done, we've put in a farm stand in a community where there's no grocery store, improves health outcomes, then you should drive a policy that says you should do that in those communities. And so I agree, although the solutions may differ from community to community, I would argue that the strategy is the same. So my argument has been, so when I talk to my colleagues, many of them say, well, Don, that stuff that you guys are doing in South Dallas works really, really well. You're coming up with strategies that will work well in that community. My pushback is, no, we're coming up with strategies that will work in all communities. The tactics may differ. So we partner with food banks in South Dallas. In North Dallas, we may partner with Whole Foods. So the question is not whether or not the strategy works. The data supports that the strategy works. What the tactics are to implement it may change from community to community. So it's not just an issue of hunger. I think we need to drive it to be an issue.
Okay, so we're getting close to the end here, but I have kind of a fun question for all of you. And I think you should all say what is the one food that kind of your personal superfood that you think has the mystical power to change, that you would like to see more widely embraced and adopted in either your community or the entire nation. Superfoods, let's hear them.
I have one, but I'm going to let my colleagues go first.
Dr. Wesson has his.
What's yours?
Raisins.
Raisins.
So I'm a kidney doctor, and so we've done a lot of research on the foods that are kidney protected. Raisins is one of the best kidney protected foods. They're cheap and delicious.
I hadn't really thought about that. I mean, mine happens to be because I love them as apples. Apples is just for me. I still remember my mama saying, don't go out the store down, apple girl. Because she firmly believed in what her doctor told her that an apple a day is something that I needed to have. And to this day, apples are, when I think of something I want to grab for, it's apples. And they're easily accessible.
Yeah. I'm going to keep it local. Also easily grown is tomatoes. And they're plentiful and they're hot and they can be spicy and you can turn it into all kinds of cool things like salsa and jams and tomato sauce and all kinds of neat things.
Fantastic. All right. Raisins, apples, and tomatoes. That's the prescription of this panel. Thank you all for listening. Thank you for such